I'm Nathan, and I work for the Williston Fire Department. I'm a firefighter paramedic and have been a career member of the Williston Fire Department for the past 4 years. Today is the day that we start celebrating EMS Week. And what I'm here today to do is to ask you to celebrate this week with us. So the way that I thought that I would ask you to celebrate EMS Week is to explain what our ambulance is and explain how we operate from the Williston Fire Department. This ambulance that you see behind me is our primary ambulance that we have labeled as Rescue 1. So as you can see currently from your view, is that right now what you see is you see a stretcher, you see a seat, and you see a bunch of cabinets, right? But I think it's important for you to understand how the back of this ambulance is built. So the first thing that I want to start with is to start off with our stretcher and to show you the capabilities and explain how come it's built like this. So these are mounted stretchers. The cost of these stretchers are very expensive, but the reason for that is it's because it is for life safety. So these stretchers here not only prevent back injuries, right? But they also, if we get into a motor vehicle accident and the ambulance rolls over, the patients are secured and it won't allow the stretcher to roll over or to fall. So I'll give you a brief example. I'll pull it out, show it to you, and show you how this works. So on this right here, there's a red lever. You pull it, as you can see, the stretcher raises, and everything slides out for us. Once it locks in place, I can raise and lower the leg. And then pushing a button to release the stretcher forward. So it works the same in operation, the opposite way if I have a patient that is on the stretcher. I started this career 23 years ago, and I cannot tell you how many people that we've had that have ended their career because of injuries sustained to their back. This right here has been a lifesaver for us. It is now a mandate in all of our ambulance builds, and we do not have any option to opt out of that. Again, like I did say earlier in this video, it is a very costly piece of equipment, but it is something too that has saved many of lives. So to put the stretcher back in, it's just as simple as pushing the button, and if you can imagine it, it could also have a patient on top of it. The stretcher can lift up to a weight of 700 pounds for us, and then it goes right back in place. And with a simple push of a button, everything will raise. And this time the stretcher goes back in. You'll watch it lower down and lock into place. It is probably one of the best features that I've seen put into an ambulance since the start of my career. So not only with this ambulance does it provide EMS capabilities, we are also a dual trained department. When I say the words dual trained, it means that we are also fire-based and we are all fire trained. And our cabinets as well, it just does not have EMS equipment, but it also has fire equipment. A lot of times the rescue responds with the engine company or even with our ladder company that we're trying to fill with staffing to actually go to all the fire alarms, motor vehicle accidents, on top of any kind of rescues, searches. This is the primary piece of equipment that goes out. So as you can see, for us, we dual function between engine, which when I say engine, I mean the fire truck, to our ambulance. So in here you can see we keep all of the same gear. We keep bunker coats, SCBA tanks, bunker pants, and everything that's utilized to have to turn around to fight a structure fire or to keep ourselves safe on motor vehicle accidents. In the other compartments, we not only specialize in EMS and just fire, but we also specialize in rescue too as well. So in here we have cold water rescue suits. We have throw bags full of rope in case somebody's being swept down the river. We carry bulletproof vests and we carry ballistic helmets on top of first aid kits. Williston Fire Department's proud to say that we are all trained in the TECC program. So whenever there's an active shooter, we are the agency who responds in Williston for any kind of active shooter situation. Inside of this compartment right here, we carry our main O2 for the ambulance. as well as many different kinds of splints. We have traction splints, full body splints, vacuum splints. We even have big, as I call them, they're tarps basically. So we'll utilize these, and if we have a person who's down onto the ground and we have to carry them out, we can utilize these tarps to do that safely and effectively. The front of our ambulance is just like the front of any other vehicle. There's nothing new to it. The only difference that we have in ours is we have a computer that's built in right here. So this has our active CAD system. We utilize Active 911. So whenever we get a call, our call will pop up on here. It'll tell us what we're going to, the address, and not only that, but for sometimes we get mutual aided into outside cities, as for instance, Richmond, South Burlington, Essex. It also has a built-in mapping system that allows us to get to our locations. That's pretty much it for the front of the ambulance. So now I'm going to take you to where I have the best time, and that's in the back, because that's my opportunity to help people in their worst time of need. So over here, you got to keep following me and turn around and have this excitement. So in the back of the ambulance is a mini ER room. Pretty much everything that sits inside of an ER room, we have the capabilities to do in the back of this ambulance. We are a paramedic level service, which is the highest level out of hospital providers that you can have. Williston Fire Department's proud of it because we have 6 of us. The program now for paramedicine is almost a 2-year program to be able to get your actual licensure. It's a big step. It's awesome that the town of Williston is able to offer that, and we're happy to be able to use those services for our community. The stretcher we already went over. You can see too, we have a lot of cabinets in here. So the ambulance is designed to make everything easily and quickly accessible, right? So we have the front of the ambulance, which if I look at the stretcher, we have the patient's head. So all of my airway stuff is built into this cabinet right here. So if I need to give a person oxygen, if I have to intubate a patient, when I say intubate, meaning putting in a breathing tube, all of my equipment is right here. Over here, we have our Zoll X Series monitor. It's a great piece of equipment. Again, highly expensive piece of equipment, but what it allows us to do in the back of the ambulance is unreal. With this piece of equipment here, it's no different as being in a doctor's office or in the ER. We can obtain blood pressures, heart rates. We can even go as advanced into doing end titles as well as doing 12 leads. At the paramedic level, we have the capabilities to actually interpret 12 leads and treat any kind of cardiac arrhythmias, as well as identify myocardial infarctions and so forth. This unit here also has a built-in AED unit into it, which is great because when we do have those cardiac arrest calls, this monitor here is what goes in, and we have that option to turn around and to start early shocks inside of a house as well. My favorite cabinet, as I like to call it, is this cabinet right here. So this has a lot of our fun equipment. This box right here is our video scope. So if we have to intubate a person, what it is it's an actual camera built a laryngoscope, which is really cool. I'll show it to you the way that it's built and designed. So when we have to put in a breathing tube, a lot of times it used to be we would have to go in, try to visualize the vocal cords without having any kind of access, and there were unfortunately a lot of missed tubes in the older days of EMS. As you can see now, what we have is we have a camera that goes in, so it allows me to be able to visualize what I'm looking at inside of the mouth. Great piece of device. It almost gives you 100% success rate with doing intubations, and overall I'm glad we have this piece of equipment, and I hope for those of you that are watching that we never ever have to use it on you. This bag right here is our EasyIO bag. What's great about this is if we are unable to get an IV, When I say the word IV, the best way to explain that is it's the needle that either goes in your arm or in your hand when you're at the hospital or they have to draw blood, etc. So in this bag here, what this is this allows us to give easy access into our critical patients by using a drill that almost looks just like a Dremel. And what we do is it attaches to a needle on here, and we actually insert it into the bone. So we'll use this, we'll drill into either the humeral head, femoral head, or the tibial osseous, and we'll seed in that it's almost like an IV, I guess, in a way, but think of it as a drill bit with a hole in it. And then that's how we'll get access. What's great about that is it puts us right into your bone marrow, so we have great vasculature beds, and it allows the medications to work even faster. Again, this is our last ditch, but if we have to use it, we are ready for it. For the patients that have breathing problems, we have a CPAP machine as well. What's great about that is it allows us to push forced air. A lot of times you'll see that with our congestive heart failure patients, sometimes even our COPD patients, as well as, in worst case scenarios, asthmatic patients. We also have IV pumps that are built back in here that will come out, and we'll utilize that to hang drips. We can hang pressors, so if a person's blood pressure is low, we can hang medications to try to help out that blood pressure and get everything stabilized before we get to the hospital. What a Williston Fire Department's pride and joys, as I like to call it, is the hand Tevi bag right here, this blue one, which is our pediatric bag. The Williston Fire Department was the first agency in the state of Vermont to offer the hand Tevi method of pediatric care. It is the most widely regarded pediatric care that is available within the out-of-hospital market. You're now starting to see it even being utilized in many hospitals outside of the state of Vermont, and currently trying to actually transition it into the hospitals in Vermont. It has been a huge success. A lot of our pediatric populations have actually benefited very well with this, and a lot of lives have been saved with this program. This red bag right here is our ALS bag. So this again goes for our higher level of care. So we carry a lot of our medications that we give out. We have antiarrhythmic medications, we have steroids, you name it, whatever kind of medical event, we pretty much have it inside of here that we can turn around and start actually treating you on scene. If you think about how EMS has changed over the past 20 years, the theory used to be like, let's just get them into an ambulance and then get them to the hospital. Now what you'll see is with the training and the technologies and advancements of the actual providers, you're starting to see that we will now stay on scenes longer. We will start treatments, and before we get to a hospital, we actually have the patient stabilized and in better shape. And what that's actually doing is that's reducing admit times. So people are being discharged out sooner, on top of getting the care that actually prevents long, I guess, term effects. COVID is still a thing, as much as I hate to bring that up. So after every respiratory distress call or anybody that's sick that runs a fever, we take a little bit of extra care in our ambulance, and we utilize this solution right here. It's called Vital Oxide, and we will use a paint sprayer. We will spray everything down in this ambulance, and it goes for our stretcher, monitors, equipment, everything that we use will get sprayed down with this. We'll sit for 10 minutes and make sure that this ambulance comes out completely sterile. It's very important for the Williston Fire Department to make sure that every patient that we put into the back of this ambulance gets the best of care and the best treatment, and this is one of the ways that we can actually provide that. I know I'm doing this on the whim, and it's fun and it's exciting, and I'm glad that you're watching this, and I definitely hope you can excuse all the ums that I say, because as I hear myself say it, but I definitely had a blast with this, and I'm glad that you're taking the time to watch this video. Please, if you ever get the chance, Williston Fire Department's always open. We would love to have you come and take a tour or visit. If you have any further questions, please make a phone call or show up at our front doorstep, and any of us would love to basically give you a tour. And thank you again for everything, and thank you for all of your support to the Williston Fire Department.